The vaccine so far is proving to work very well, even in the elderly, which was a concern that we all had early on.
When will India have a vaccine against coronavirus disease, and how safe and effective will it be? Well, these are questions all of us are asking. And lately we've had good news on the vaccine front globally. We've had Pfizer telling us their vaccine is 95% effective, and Moderna saying their vaccine is 94.5% effective. But these vaccines are expensive, and they also need to be stored at ultra low temperatures. Sometimes the Pfizer vaccine has to be stored at -70 to -80 degrees, which is actually colder than the Antarctic winter. So the whole world is really focusing on the Oxford vaccine, which is a vaccine which is available through COVAX, which is the WHO-supported organization which provides affordable vaccines to poor countries. And there the vaccine is available for $2 a dose. And India plays a huge role here because we have Serum Institute and Mr. Poonawala, welcome to the show, who have the capacity and the capability to manufacture millions of doses of these vaccines in a very, very short time. So now we're going to talk about how safe and effective these vaccines are. Global trials are going on already. We have the Oxford AstraZeneca vaccine, which is being, the trials are going on in the United States, in the UK, in Brazil, and South Africa, and the trial has also begun in India. So I want to ask Mr. Poonawala, what are the early findings? What do the results show?
Firstly, a very good evening to all your distinguished panelists and participants here at the Hindustan Times Leadership Summit. Nice to talk to you. If we go back to April, May, never did I even dream, and my team here of scientists at Serum Institute, that we'd have such a good vaccine developed, or all these other vaccines developed so quickly by the end of this year. So whilst, you've got, as you rightly mentioned, the Moderna and Pfizer vaccines that are a little expensive and very difficult to store logistically because of their temperatures, they are seeming to be very powerful and effective. The real question is, how long will it protect you for? You want a vaccine that can protect you at least for a couple of years. That's the goal that the health community and all the developers are trying to get to. What we've heard so far is that the Oxford AstraZeneca product, that is one of the products that we're going to make, and I just want to correct you, we've done a deal at $3, not $2, with COVAX, which is, the body that is Gavi, CEPI, and WHO. The vaccine so far is proving to work very well, even in the elderly, which was a concern that we all had early on. It's induced a good T-cell response, which is an indicator for your long-term immunity, and then you've got a good antibody response as well. So time will tell whether these vaccines are really going to protect you for the long term. Nobody can answer that for any of these vaccines today. Anyone claiming that is, just shooting in the dark and hoping. We're all hoping that these vaccines, all of these vaccines, protect us for the long term. So we'll have to wait and see. Having said that, we in about 2 to 3 weeks are told that the UK and other studies for the Oxford AstraZeneca product, the efficacy results will be announced and the trial will be unblinded. So we should wait and watch what that has to say, and then we can decide. But irrespective of that, as you know, and we've been talking about it, that we've been making and stockpiling millions of doses ahead of time so that, we can get a head start on the supply.
So what you're saying is we will get results by, let's say, the first week of December from the global trials. What does the data from India show? Because a lot of people have been vaccinated across 15 centers here as well.
Well, there's been no safety concerns. Everything's been fine. And, even the Indian study is a much smaller study with 1,600 patients, because it's only a bridging study to show equivalence and show that it's the same. So at least from the safety angle, we've heard no complaints or major reactions, adverse events. So that's always a good sign. And that was, of course, expected because it had already gone through a safety study in the UK. So we'll have to wait and see. And even the results for that the efficacy, partial immunogenicity results rather, that'll come out with the Indian study also in about a month, month and a half. So we'll wait and watch.
So if we get emergency use authorization, when is the earliest that we can get a vaccine in India?
Well,
we all want to know.
Yes, of course, that's the main question that everyone wants to know. And as soon as the UK authorities, the MHRA and the European, the EMEA approves it for emergency use, we will apply to the drug controller in India, and hopefully very soon we can also get an emergency use authorization. Again, that'll be, just to clarify, a limited use for the frontline healthcare workers, the elderly and all of that. So again, for everyone watching, it's going to take another 3 to 4 months before it's available, to the general public, because that's the way the emergency use licensure will probably work.
What you're saying is by April or May, we should all have access to this vaccine, right? In India.
That's right.
That's excellent. And what about children? Because will we have data on children by then, or will it just be for adults?
So in about 3 or 4 months, we'll have data on, the below 18 years of age group. Right now, the vaccines are recommended from 18 plus to, 90 or whatever. And so I think the children will have to wait a little bit longer. But the good news, as we all know, is that it's not so bad and serious for the children. So this disease, unlike other diseases like measles, pneumonia and all, which are very deadly for children, this disease is seeming to be less of a nuisance for children. And of course, they can still be carriers. If the schools are open and they get infected, they can give it to you. So that's why we want to vaccinate the elderly and others first, who are most vulnerable. And then once we have enough safety data to go on in children as well, then we can roll it out and recommend it, for children in about, I would say, 3 to 4 months from now.
So you tweeted yesterday saying that a good vaccine is a vaccine which is safe, effective, is easy to store and supply, and also offers long-term protection. So would you say the Oxford vaccine fits the bill?
Well, so far it's ticking all the boxes. Of course, on the point of the long-term protection, as I said, only time will tell. We need another 6 months to a year to know that. But of course, it's very affordable. It's certainly safe. And it's stored at +2 to 8 degrees, which is a temperature that, all the reefer vans and trucks that we have in India and the cold storages that we have, which is basically your logistics and infrastructure that India has, it's the ideal temperature. In fact, some vaccines will be at -20, and of course, some which are even harder to manage at -70. But so if you look at, the different ranges of vaccines that are being developed, both in India and globally, +2 to 8 degrees is the best temperature.